Nyní poprosím paní Bhaswati Bhattacharyu.
And now I would kindly ask Dr. Bhaswati Bhattacharya from Weill Cornell Medical College to give her contribution.
Dr. Bhattacharya is a clinical assistant professor of family medicine at Weill Cornell Medical College and a Fulbright specialist in global public health, specializing in integrative medicine. She is a Harvard-trained physician with a PhD in Ayurvedic chemistry and pharmacology. She has spent over 2 decades bridging indigenous medical systems with modern biomedicine. The stage is yours, sorry.
Thank you. Welcome to a wonderful Friday, first Friday in October. I was asked to talk a little bit about why we are here as TCIM people. Some of us are doctors, some of us are healers, some are scientists. We come from a wide variety of backgrounds, and this year Thomas has worked to get more and more multidisciplinary people here. So we're not just a bunch of nerdy doctors and scientists who talk about math and analytics, but rather about spirit. As a child, I grew up in India. My childhood was in Bengal, and I spent time watching the Bangladesh War, which was the war making East Pakistan turn into a new country of Bangladesh. And I saw things that no 3-, 4-, 5-year-old should see. Cut off bodies and heads full of blood and shooting. And I saw the suffering from that. And of course, we were taken out of that. And I asked the question, how do we heal? And I think that has been what has given me the clarity to do what I do for the last 40 years. I asked the question, how do we heal and why do we heal versus why do we not heal? So as a child, I was kidnapped. My sister and I had very different experiences. I took it and I said, I survived. My sister took it and went into psychotherapy of why did this happen to me? And the two of us are very different. She's a physicist, of course, working for NASA and doing very big things. I decided to study medicine, thinking I'm going to find the answer to how we heal, and I'm going to help people. What I didn't realize is that when I went to medical school, I was actually drafted into becoming a prostitute for the pharmaceutical industry. And when I'm in a very good mood and I go to parties and people ask me, so what do you do? I say, I'm a prostitute to biopharma. I sell and prescribe drugs, because that's all I was taught to do in medical school. When we learned pathology, they did not tell us how to prevent the disease with acupuncture, massage, mind-body, Ayurveda, herbs, homeopathy. What they taught us is, this is a pathology, and these are the drugs. And progressing meant getting worse toward death with the disease. So I started naturally asking, well, this is not answering my question of how do we heal? So I started studying other things. If you go to New York Presbyterian Hospital today, they will tell you where to find the witch doctor. I'm the witch doctor. And at first I thought it was an insult, but the patients would wonder, and then they would come to see me, and the reputation around the hospital became, she can do things that some of the others can't. I don't think that healers are necessarily magical people. I think magic is everything that logical people refuse to understand, refuse to see, refuse to analyze with variables that they don't want to believe in. And several of our speakers before have talked about this, and I so appreciate your words. When I ask, how do we heal? I'm open to all modalities, and I spent a lot of time doing that. So I got a lot of labels: dilettante, Duke of all trades, does not know, or sorry, I think it's Jack of all trades in English, does not know what she wants. She's a doctor. She should just practice modern medicine, evidence-based medicine. And so I would ask people, you want to talk about evidence? Let's talk about evidence. As the gentleman talked about before, what is evidence? And you'll hear a little bit more about that from me tomorrow. Most of us who experience things and heal don't really care about how many people needed to be treated to get a benefit from a drug. They don't really care about how many people died or didn't die. They want to know if that drug works for them. And when people say, oh, come on, you should standardize that medicine. Ayurveda is not standardized. Homeopathy is not well, that's not actually true, but homeopathy is not standardized. Herbal medicine is not standardized. I say, let's say we do a study and we take everyone in the room and we say to them, we're going to randomize you, we're going to placebo control, we're going to double blind. And for randomize, we're just going to pass out shoe size 6, 7, 8, 9, 6, 7, 8, 9, 6, 7, 8, 9, which is randomized. It's not going to fit the person if we randomly put it on them. That's a very obvious example. And yet, in medicine, they think that randomizing is superior. Every healer knows you can't randomize medicine. Then why is that the gold standard? And why do we stand up here and think we're superior because we randomize studies or we randomize protocols and medicines for people? Placebo is the inner pharmacist. It's the chemicals that your brain, the serotonin, the dopamine, all the chemicals we study, it's that ability to put those out. When organic electricity fills this room every night at 8 o'clock, and many of you know this, you come here for this, that organic electricity is changing the chemicals of your body, and those chemicals are then changing your neural tissues, your muscle tissues, and the way your metabolism operates. And that is why many of you in this room have healed from diseases that are incurable. So in my quest to answer how do we heal, I now specialize in incurable diseases. That includes everything from heart diseases and diabetes and cancers. And what I find is that our ability to heal is about our BS. Not bullshit, but our belief systems. And when we shift our belief systems, we can have sudden healing. I've seen it in thousands of patients. And I know that if we can move the legitimacy of TCIM in our own hearts, we can actually start expressing it in this world. So I have colleagues who will say, and you'll hear from some of them, they will say that, why don't we take back our power? Why do we always allow allopathic medicine and modern medicine and the systems of the law to stay? We are the humans that create the law. Why don't we start to change the laws? And I believe that this group of people sitting together can slowly shift our own hearts and each other's so that we can take back that power and walk into our states, our nations, our provinces, and tell the people who are just, quite frankly, they are ignorant, they are, how can I say this nicely? They are looking for whatever is comfortable for them. How can we help them to see that without changing the laws, they and their family can't be comfortable, and the people that they are leading, supposedly, as ministers, those people cannot be comfortable. We have to cooperate to change the laws. We have to help each other by sharing what we do in our country that works and what we have done in our country that is an error, that has been very bad for our countries. So I go between the USA, France, and India. In India, we have 8 legal systems of medicine. Many of you know Ayurveda, Unani, Siddha, Soaripa, homeopathy, yoga. I said Unani. Ayurveda is probably one of the main systems, and yet it sits as a poor cousin to allopathy. And any Indian person who gets good scores in their lower schooling is told that they should go into MBBS training, the modern medical training, and not becoming a healer or doing Ayurvedic work. And that is a detriment to the TCIM's even in a country where it's legal to practice these medicines like in India. In China, traditional Chinese medicine has a space, but there's also the vogue of modern medicine. So they have a system that is interesting, and you'll hear more about that from Akshay Bambri tomorrow, who's been comparing 4 countries and the way that they legitimize or don't legitimize medicines. In France, we have national health medicine, national health care, and at the same time, there's a huge number of people that just accept the fact that they are going to go to their osteopath, their chiropractor, use herbal medicine, use homeopathy. They don't need it from the mainstream medical system. They kind of wish it was part of it. But I find the French doctors are arrogant that they are the legitimate and everyone else is lower class, every other kind of healer. And that's a huge problem if you talk to, for example, the person that grounded Ayurveda and yoga in France, Kiran Vyas, who's here with us, and he will talk about how his university, they have police breaking in and saying, prove us that you have a license, and tries to delegitimize the work that he's doing. So, what's legal, what's not legal. And in the USA, we have 11 states that have health freedom. So as long as you don't claim you're a modern medical doctor, you can practice your art. And yet, even the people of TCIM that practice in America are so ignorant about the laws themselves. The Ayurvedic doctors are frankly just, how can I say this nicely? They're not smart. They don't study. They don't know what the laws are. And so they end up practicing in ways that are of detriment to the patients. When we come back to the question of how do we heal, this is what I look for. This is what I can sense. And if you go back into the Indian knowledge systems, Ayurveda, it was mentioned that I did a PhD. I did a mid-career PhD in Ayurveda. I think what it did for me is it not only made me legitimate in some ways, because I think being a medical doctor today is kind of illegitimate, as I mentioned before. But I do believe that there is knowledge in Ayurveda that spread throughout the world that I was hearing in the previous talks. Jagadish Chandra Bose talked about the biological principles in plants and the energy, the living energy in plants. And I teach all of my students before plucking a leaf from any tree, plant, shrub, ask permission. These principles have been known in Ayurveda for thousands of years. And if you read the text, the Ramayana, where there's a medicine that's given to one of the characters, you'll understand that this medicine has been alive for 15,000 years. The Brits can say it's only, 1,000 years old, 2,000 years old, and Hippocrates did everything. But there's a lot of evidence that Shushruta, who is a surgeon of Ayurveda, wrote books that carried across the ships into the Mediterranean, and they landed on the island of Kos, from which there was a man named Ctesias who wrote a book on Indica, that talks about the 4 humors, which Shushruta talked about, not the 3 doshas. And from that, many things were assumed by Hippocrates. If you study the history, you will see that many parts of the world, including China, the Yellow Emperor's textbook of medicine says that we got our knowledge of traditional Chinese medicine from India. I don't want to expound on the fact that Ayurveda knew everything, but it is one of the central systems of medicine that talks about how we must respect nature, how woman must be respected because she is the seed, she is the soil on which the seed grows. It talks about the importance of herbs, the importance of nutrition. And if you just study some of the tenets of Ayurveda, you'll find that there is healing for the healer, healing for the patient, and healing for the ecosystem. And so I found it to be a very complete system of medicine. And I look for Ayurveda in many of the other systems, whether it's Yoruba medicine in Nigeria, or it's the tribal systems that are expressed in southern Africa, which Rupert will be talking about tomorrow, or whether it's homeopathy, which is very much part of Sukshma Ayurveda, the minute dilutions of particles that resonate with the water and therefore magnify the effect. There's a lot of things we can learn from each other. I'd like to end by asking all of you, each of you, to spend some time with healers of other cultures, other languages, other systems. You know, if you're German, you don't have to only sit with the Germans, or if you're Czech, don't only sit with the Czech. Learn from each other, because what Thomas has put together this weekend is a chance for you to learn things you never knew existed. Please spend time listening to people in the talks and interacting with them afterwards, because it's when we each learn of things we never knew existed, we are going to get that courage to go back into our heart and then demand that the right to healing belongs with the people and not with the ministries and not with the people that are given the power. We need to take that back in the next few years, because as the capitalist world closes in and tries to take away things from us, the one thing they cannot take away is our relationships and our sense of healing. So I leave you with that. I hope you have a very good conference and meet people that you never even knew could teach you what they will teach you. And please hug each other, be with each other, and be kind to each other. Try to find that humanness in people around you, because we are all healers and we're all here to heal each other. Thank you for listening to me. Namaste.